Right now, we're going to have our last talk. Dr. Bill Williams is going to speak to us regarding the effects of contraception on the body of the woman. And I think this is going to be very, very enlightening for all of us because we also often see this in its moral dimensions, but very rarely do we get a chance to see it in its clinical dimensions. And Dr. Williams will give us a very good presentation on that.
I hope. Members of the clergy and members of religious communities and brothers and sisters, it's a pleasure to be here. I want to thank Steve for inviting me to talk on this issue. And I want to put a little bit extra in here because I think the reason we're here today is because we've lost the hearts and minds of the populace. People today assume that all these services that are going to be provided are really good for women, they're good for families, and that's just simply not true. And one of the things that we have to do today is we have to win back the popular opinion on some of these issues. So, you know, there's a lot of talk today about a war on women, and I have to agree, there is a war on women. But it's not the war that's talked about. It's actually a war that would seek to reduce women to objects so that men can use them for sex without consequences. That's the real war on women that we're talking about today. And that war is being waged by our media, by our society, and now by our government. And, you know, they control, the women who want to put women down in this, people who want to put women down in this way control the media, and they control the radio, the governments, the internet, right? But, you know, there's another war going on right now that people don't talk about, and that is a war on children, okay? And I think in this room we're very well acquainted with this. This war actually seeks to do several things. First of all, prevent their conception. Secondly, if that didn't work, let's abort them. And then third, if that doesn't work, let's deny them of having a father and a mother, okay? That's where we are. And again, this war is being waged by those who control the television channels, the cable networks, the internet, the radio, and now the government. So what do? What weapons do we have in this war? As I mentioned, those who seek to demean women and children control the media and the government. We only have one weapon to fight back with, and that's the truth. But we have to know the facts and learn to speak the truth in love. Because if we can do that, then we can actually make some headway in this war. And the good part is that unlike our adversaries, we don't seek to enslave women and children. We seek to liberate them so that they can live fulfilled and beautiful lives. And we have to also insist that those people who support the right of women to choose also that they have a right to know the facts of the consequences of their choices. And that's what I'm going to be talking about today, is the consequences of these choices that people are insisting that they have, particularly with respect to what is in the HHS mandate. So what's covered in this mandate? First of all, contraceptive drugs and devices are covered. This includes hormonal contraceptive pills, patches, implants, all those kind of things. Secondly, surgical sterilization is covered. And then we also have abortion-inducing drugs and devices, such as emergency contraception, Plan B, morning after pills, LO1, and also IUDs are covered. So why would we object to these things? Well, medically, I think the most important part is that none of these items treats any disease or disorder, but rather they take a normal functioning bodily system and they render it non-functional. Secondly, this definition of preventative services, as John DiCamillo mentioned, includes items which are actually disservices rather than authentic services. They injure people physically, psychologically, socially, and spiritually. So a service implies some good is going to be given to the person who receives it. But these preventative services actually do not produce goods. They produce harms. And that's what I'm going to be outlining in the next few slides. So first of all, let's talk about the medical consequences of just hormonal contraceptives. Well, there's some very common side effects, and I think a lot of people know them. They can cause nausea, weight gain, sore or swollen breasts, mood changes. A lot of women who take these hormonal contraceptives have these effects. And then there's less common side effects, but much more serious. Things like increased risk of blood clots, strokes, heart attacks, pulmonary embolism. There's an increase in gallstones, migraine headaches. There's actually a risk of blindness from something called pseudotumor cerebri. And there is physiological depression that happens in these women. I think Pat earlier mentioned that there's also an increased risk of breast cancer, but also cervical cancer and benign and malignant liver tumors. In fact, the combined estrogen-progestin hormonal contraceptives are classified as group 1 carcinogens. So these things have a lot of deleterious effects. Well, what about morning after pills? Well, these have a lot of common side effects, and they happen in probably 20 to or higher percent. Actually, some of these are much higher percentage of patients, but some of the more serious ones happen in up to 20% of patients. Things like nausea, vomiting, diarrhea, abdominal pain, fatigue, headache, menstrual changes, and dizziness. So it's not just a simple matter of taking this pill and then the developing embryo won't stick to the uterine lining. It has serious consequences on the women who are taking these things. What about IUDs? Well, IUDs prevent the implantation in the womb of any embryo conceived, so it's basically inducing an early abortion. IUD use has 10 times the risk of ectopic pregnancy compared to women who do not have an IUD in place. An ectopic pregnancy can rupture and can be life-threatening. It also confers a 1 to 2% overall risk of perforation of the uterus and pelvic inflammatory disease, which can then be sterilizing. So there's a lot of negative consequences. What about surgical sterilization? Well, sterilization procedures are major surgical procedures, including the use of general anesthesia, which confers a risk of a reaction to the anesthesia and therefore of death. The procedure also has common surgical risks of bleeding, infection, blood clots, and then the procedure may fail, and if it does, then there's a very high chance of ectopic pregnancy resulting from that, and that also can be life-threatening. But it's not just medical side effects that I'm concerned about. There's other effects. There's psychological effects. So, for example, hormonal contraceptives decrease sexual desire in women by interfering with their normal hormonal balance. Now, I just have to stop here and ask a question. If we went up to men and said, we've got this pill that'll, prevent you from fathering a child, but it's going to decrease your sex drive, it's going to put you at an increased risk for blood clots, strokes, heart attacks, cancer, what do you say? How many men do you think are going to sign up for that? Okay, that's why I say this is a war on women. I don't think men would ever dream of signing up for such a program. But it's not just that. These contraceptives actually diminish a person by interfering with the normal functioning part of their body and rendering that person sterile. And this can actually cause the sex partners to look on themselves or their partners as a sex object. And when you objectify a person, you diminish them and hurt them psychologically. It's an attack on their sense of dignity as a human person. Then there's also sociological effects. These include the increased risk of divorce. We know that married couples that use contraception have a much higher rate of divorce compared to those who use natural methods of family planning and fertility awareness. We also know that divorce has a very negative impact on the spouses and on their children. And in a marriage that uses contraception, you get the risk of these negative consequences. So sociologically, we have negative effects as well. And of course, I have to touch on the spiritual effects, which I think, as Catholics, we really have to be cognizant of, because to me, this is really the source of all the other evil effects that come from this. First of all, Catholic Christians believe that married couples actually share in the inner life of the Blessed Holy Trinity. God the Father loves his Son Jesus, and Jesus loves the Father. And the love between them is so real that it is a third person, the Holy Spirit. And in the same way, when a husband and wife come together in the marital act, the love between them can become so real that it becomes a third person, a child. And by deliberately sterilizing the marital act, this participation in the inner life of God is destroyed, and it diminishes the couple. And of course, there's more spiritual effects. Contraception destroys one of the two most profound meanings in every act of marital intercourse, and those two meanings, of course, are to unite the couple and to be open to the possibility of children. It introduces an inner disposition of withholding part of yourself from your spouse, and turns what should be a generous act of total self-giving of two married persons to each other into a selfish act. By eliminating this openness to procreation, it implies a closing of the heart, which can hurt marriages, hurt the spouses, and hurt the children. And the children then come to be seen as products that can and should be rejected when they arrive unexpectedly. So to me, this is at the root of all the other problems. So in conclusion, I just want to tell you that contraception, sterilization, morning after pills, and IUDs are not healthcare services. They are disservices. They treat no disease and alleviate no suffering, and they all have serious side effects. And because of this, no one should be forced to provide these disservices, either to their employees or, if you're an insurance company, to the people that you insure. We must learn these facts and learn to speak the truth in love, because we know that the truth will set you free. And we must insist that those who support the right to choose also have a right and, in fact, an obligation to know what it is that they're choosing. Thank you.
Okay, we could take a few questions.
So the question was, this is a war on women. Yes, but isn't it also a war on men? Doesn't contraception and these other, disservices, I'll call them, doesn't it also have a negative impact on men? And I believe that it does. I think if you go back to some of the things that I mentioned on psychological effects, it tends, I kind of have a general rule in terms of thinking about ethics, that if you do anything that makes you more virtuous, more self-giving, and more generous, you become a greater person. But if you do something that makes you more selfish and more self-centered, it diminishes you. It makes you a lesser person. And when men concede to contracepted sex, to sterilized sex, it's really diminishing them. God gives us a choice. The choice is between participating in his life-giving love or sterile sex. Now, how can you choose the second one without realizing that you've diminished yourself by giving up something that is so much greater? So yes, I believe it is also a war on men. Sister. Yes, sister. So the question is, do the doctors get some kind of moral and ethical training, and can they then use their morals and ethics to reject prescribing some of these things? And the answer is kind of yes. Let me answer the second question first, because it's actually easier. Yeah, you can actually, and there's several pro-life OBGYNs and internists and family practitioners around, not a tremendous number, unfortunately, but there are a few. Catholic Medical Association's website has access to other links that can mention some of them. And they can. I have patients come to me occasionally, although I'm a rheumatologist, so I don't get a lot of people asking me for contraception. But if they mention it, I always tell them, well, look, I just don't believe that fertility is a disease that needs to be treated, so I won't prescribe that. But in terms of the ethical training of doctors, the problem we suffer from today, and again, it's a societal problem, is that if you think of ethics and the different ethical principles that are out there, there are some that are very important, like do no harm or try to do good. But one of the other ones that's now, unfortunately, has become the most prominent in our society is autonomy. Yes, people should be allowed to choose what they want to do. Unfortunately, a lot of the ethics courses that you'll see nowadays in medical schools puts autonomy as king, that if the patient wants it, they should have it, okay? And that's why we have abortion. Even though doctors know that they would never want their daughters to have one, they still refer for them, okay, because it's autonomy. Even though they may even know some of the negative consequences of hormonal contraceptives, for example, they'll still prescribe them because of autonomy. The patient gets to choose. Our difficulty and our challenge right now is to get the word out there as to what the consequences of these choices really are. And to assist that, by the way, if you go to the Catholic Medical Association website, and it's cathmed.org, and click on the button for radio ads, there's actually downloadable radio ads that you can send to your local radio station and sponsor to be on the air, so that we can get some of this word out there and maybe start to change people's minds and hearts about these things. Okay, so the point was that I'm preaching to the choir here, which is true. And you know, when the priests start preaching this from the pulpit, that's when things are going to change. All right, I hate to disagree with you, I really do. But we're talking about 30% of Catholics going to Mass. And that's the Catholics. What about all the non-Catholics? Do you think they hear this? Most of the Protestant denominations, I mean, the vast majority of Protestant denominations think that this, use of contraceptives is fine. And a lot of them think that abortion is fine. How are we going to reach those people if a priest says something from the pulpit? We will not. We need to go out to everybody. That's why we have radio ads. We need to take out billboards. We need to get in the newspapers. We need to be on the internet. We need to do much more than what we've done so far. We can't just keep be complaining about what the priest says or doesn't say. His homily is supposed to be focused on opening up the gospel for that week. Okay? If the gospel for that week doesn't have that particular point in it, how can he talk about it? It's not his mandate. It's our mandate. We are the people of the church who know the truth, and it's our obligation to share it.